A simple habit that changes blood pressure regulation. Imagine something that takes 10 minutes. No equipment, no prescription, no complicated routine. Yet it influences the same biological systems that blood pressure medications try to control. This might sound exaggerated at first, but a growing body of research has been examining exactly this idea. Not as a replacement for medical care, but as a physiological intervention that works through the nervous system. The habit is slow, controlled. More specifically, deliberate breathing that slows the respiratory rate to about 6 breaths per minute for several minutes at a time. To understand why this matters, we need to look at how blood pressure is actually regulated. Most people think blood pressure is primarily about the heart pushing blood through the arteries. That is only part of the story. The more powerful regulator is the autonomic nervous system. This system constantly adjusts vascular tone. It determines how, tightly or loosely your blood vessels constrict. When sympathetic activity is dominant, vessels tighten and blood pressure rises. When parasympathetic signals increase, vessels relax and pressure falls. In modern life, many people remain in a mild state of sympathetic activation throughout the day. Work stress, poor sleep, continuous stimulation from devices. Even subtle anxiety can keep the nervous system slightly elevated. When this happens repeatedly over months and years, baseline vascular tone can drift upward. Slow breathing interrupts that pattern. When the breathing rhythm slows, stretch receptors in the lungs send signals to the brainstem. These signals influence the vagus nerve, one of the main pathways of the parasympathetic system. As vagal tone increases, heart rate begins to slow slightly. Blood vessels relax. The body shifts away from a stress response toward a recovery state. Researchers studying this effect have found something interesting. Regular sessions of slow breathing practice can reduce resting blood pressure by several points. In some studies, the reduction approaches the average effect seen with certain first-line medications. This does not mean breathing replaces medical treatment, but it does reveal something important about how blood pressure behaves. Blood pressure is not only a mechanical problem in the arteries, it is also a nervous system signal. What the research actually shows when scientists began studying slow breathing as a cardiovascular intervention, the initial question was straightforward. Can voluntary changes in breathing influence blood pressure in a measurable way? Over the past 2 decades, multiple clinical trials have explored this question. Many of these studies used controlled breathing protocols that guide participants to slow their breathing to approximately 6 breaths per minute for 10 to 15 minutes. This rhythm appears to be important. At around 6 breaths per minute, a physiological phenomenon known as respiratory sinus arrhythmia becomes more pronounced. The heart rate subtly rises during inhalation and slows during exhalation. This pattern reflects strong communication between the heart and the autonomic nervous system. When breathing slows to this range, vagal activity increases and sympathetic activity tends to decrease. In clinical research, this shift has been associated with modest but meaningful reductions in resting blood pressure. Some trials involving individuals with mild to moderate hypertension reported reductions of several millimeters of both systolic and diastolic pressure after consistent practice over several weeks. For context, even a small reduction in systolic blood pressure can translate into a measurable decrease in long-term cardiovascular risk. Researchers believe several mechanisms contribute to this effect. First, slow breathing improves Barorflex sensitivity. The Barorflex is a feedback system that helps the body detect changes in blood pressure and adjust vascular tone accordingly. When this system functions more efficiently, blood pressure regulation becomes more stable. Second, slow breathing appears to reduce sympathetic nerve activity. Lower sympathetic tone leads to reduced peripheral vascular resistance, which can lower pressure in the arterial system. Third, the practice encourages a shift toward parasympathetic dominance. This state promotes relaxation of blood vessels and improved heart rate variability. Importantly, these effects are not usually immediate in the sense of a single dramatic drop after one session. The benefits tend to accumulate when the habit is practiced consistently over time. That consistency is where the 10-minute daily routine becomes important. What happens inside the body during those 10 minutes to understand why slow breathing influences blood pressure? It helps to picture what is happening moment by moment inside the body. The first change occurs in the lungs. When breathing slows and becomes deeper, the lungs expand more fully with each inhale. Stretch receptors located in the lung tissue detect this expansion and send signals through the vagus nerve to the brainstem. The brainstem is where several key cardiovascular control centers are located. These centers regulate heart rate, vascular tone, and the balance between sympathetic and parasympathetic activity. When signals from slow breathing reach this region, they begin to alter that balance. Sympathetic drive gradually decreases. This means the chemical signals that normally tighten blood vessels become less active. As vascular smooth muscle relaxes, peripheral resistance begins to fall. At the same time, parasympathetic influence increases. This does not shut the body down. Instead, it moves the system toward a more efficient resting state. Heart rate slows slightly. Heart rate variability improves. Blood vessels become more responsive to signals that encourage dilation. Another potent effect occurs in the baroreceptors. Baroreceptors are pressure-sensing structures located in major arteries such as the carotid sinus and the aortic arch. They constantly monitor blood pressure and send feedback to the brain to help maintain stability. Slow breathing appears to enhance the sensitivity of these receptors. When baroreceptors function more effectively, the body can detect small increases in pressure earlier and adjust vascular tone before the rise becomes significant. There is also a chemical component. Slow breathing improves gas exchange efficiency. Carbon dioxide levels remain more stable, which helps prevent unnecessary constriction of blood vessels. This stability supports smoother regulation of cerebral and systemic circulation. Over the course of 10 minutes, these combined effects create a measurable shift in the cardiovascular system. The body transitions from a mild stress state toward a more regulated state. Blood vessels relax. Heart rhythm becomes steadier. Pressure inside the arterial system begins to ease. Why consistency matters more than intensity. One of the most interesting aspects of this habit is how simple it is. There is no equipment required, no physical strain, no complicated protocol, yet the effect depends heavily on consistency. Blood pressure regulation is influenced by long-term patterns in the nervous system. When sympathetic activity remains elevated day after day, the body gradually adapts to that higher baseline. Vascular tone becomes tighter. Baroreflex sensitivity becomes less responsive. Over time, resting blood pressure may begin to drift upward. Short periods of slow breathing interrupt that pattern. Each session acts as a signal to the nervous system that the environment is safe enough to relax vascular tension. The parasympathetic system becomes more active and sympathetic signals begin to quiet down. When this happens occasionally, the effect is temporary. But when it happens regularly, something more interesting occurs. The nervous system begins to recalibrate. Repeated daily practice improves autonomic balance. Heart rate variability tends to increase, which is often interpreted as a marker of stronger parasympathetic influence. The baroreflex becomes more responsive again, allowing the body to correct pressure fluctuations more efficiently. Gradually, the resting baseline can shift. Instead of operating in a constant state of mild stress activation, the cardiovascular system, 8-year-old, spends more time in a balanced state where blood vessels are not unnecessarily constricted. 10 minutes may sound small, but when repeated daily it becomes a powerful signal. It reminds the nervous system how to regulate pressure rather than simply react to stress. How this 10-minute habit fits into real blood pressure care. It is important to place this habit in the right context. Slow breathing is not a substitute for medical treatment when hypertension is severe or when a physician has prescribed medication. Blood pressure is a complex condition influenced by genetics, kidney function, vascular health, metabolic state, and lifestyle patterns. But the research around slow breathing highlights something that is often overlooked. Blood pressure is not controlled only by the heart and the arteries. It is also strongly influenced by the nervous system. When the autonomic system remains locked in a constant state of mild stress activation, vascular tone increases and pressure gradually rises. Medications work by targeting different parts of this system. Some relax blood vessels. Some reduce fluid retention. Others slow heart rate. Slow breathing works through a different pathway. It helps restore communication between the brain, the heart, and the blood vessels. By strengthening parasympathetic signaling and improving baroreflex sensitivity, it supports the body's natural ability to regulate pressure. This is why the practice is often described as complementary, rather than competitive with medication. It addresses the regulatory side of blood pressure rather than the mechanical side alone. For many people, 10 minutes in the morning or evening is enough to produce the physiological signals that encourage relaxation of the vascular system. Over time, this consistent signal can help lower baseline sympathetic tone and stabilize cardiovascular rhythms. When combined with other evidence-based habits such as regular physical activity, balanced nutrition, OT, restorative sleep, and stress management, the effect can be meaningful, not because any single habit is a cure, but because the cardiovascular system responds best to patterns that repeatedly reinforce stability. Sometimes the most powerful interventions are not the most dramatic ones. They are the small signals you give your body every day that remind it how to regulate itself.